In this video, let us look at this book, The Washington Manual of Medical Therapeutics. This is South Asian edition. And the editor is Archit Bulur. This is a very different shape of book in the sense the dimensions. This is the second edition, which is latest as of today. So looks like this book I feel could have been they could have reduced the number of pages and made each page a little bigger, right? I'm not sure, but so the chapters here are this is not any I don't think this book has photos or anything, so let us just look at this. Internal medicine, acute inpatient care. So here they are talking about hypertension, perioperative measurement, management of specific conditions. But exact hypertension, if you're looking, it's there here under preventive cardiology. Other things that are there here: ischemic heart disease, heart failure, cardiomyopathy, pericardial and valvular heart disease, cardiac arrhythmias, critical care, everything on earth, obviously, obstructive lung disease, pulmonary disease. So all the pulmonary diseases, let's see what they are covering. Pulmonary hypertension, obstructive sleep apnea, hypopnea syndrome, interstitial lung disease, hemoptysis, cystic fibrosis, solitary pulmonary nodule, bronchiectasis, and pleural diseases. See, the thing is, here you did not see asthma in pulmonary disease. They have put that here under obstructive lung diseases because it's of the airway, right? So asthma is here. Okay, that makes sense. COPD, asthma, and pulmonary diseases will be beyond the airway, right? Renal diseases, allergy, fluid, electrolyte. And you can look at the other things: treatment of infectious diseases, sexually transmitted diseases, disorders of hemostasis and thrombosis, liver diseases, almost everything on earth. Diabetes is there here. So I'm just looking at the contents, very much detailed. Emergencies, toxicology, palliative care, medical disorders in pregnancy. Very elaborate contents they have given. Okay, so there are a lot of tables here, and this is, like I told you, not glossy. This is a good thing, na? The pages are not glossy, so it doesn't reflect light, and there are no images, which could be a bad thing, but let us see the content what they are trying to give. We will come to one individual topic later. Okay, there is a flow chart here. This book is, like I told you, right, very difficult to handle because it's thick and the pages are small. Okay. What do you mean by ACS symptoms? So STEMI 1, that is ST elevated MI. Otherwise it is a non-ST elevated MI. Okay. And if it is a ST elevated MI, then you are giving thrombolysis, right? Fibrinolytic thrombolysis is required only if it is ST elevated. Otherwise you don't need. If it is non-ST elevated, you will have moderate to high risks means they're having invasive strategy. Low risk means ischemia driven strategy. Where will you give? What will you give? Low molecular weight, heparin, etc. They're talking about, right? You can just look at this in detail. I'm just saying. The full forms, where have they mentioned? Okay, so that kind of is nice. Bear with me, the book kind of wants to close by itself all the time. More flowcharts here. Let us look at this. Sequential ECG changes in STEMI. Normal morphology. Lasts for a few minutes. Hyperacute T waves. Wide and tall. ST elevation. I definitely need somebody to hold this book down so that I can read it. Hours to days fibrosis. So here you can see Q waves. They've gone down, is it? T wave inversion. Days to weeks. The ST elevation improves. Okay, here you can see the ST elevation improves, but what is there? But these Q and T waves are there, and years and decades later also the Q wave persists. Interesting, right? And the T wave normalizes. So the only clue for you after years or decades will be the Q wave, isn't it? Interesting. Something we learned by reading this book. There are a lot of flowcharts. New York Heart Foundation, NYHA functional classification, this you know, no? Breathlessness on doing some activity. So let's jump a few sections and go to other chapters. The flowcharts are nice. Like I was looking for a lot of flowcharts kind of thing. What are they talking about here? The chapter is critical care, and here they're talking about mean airway pressure, inspiratory time, PEEP, positive, expiratory, end expiratory pressure, isn't it? So how you can give positive pressure for the ventilator, isn't it? What ventilator setting, something that like that they're talking about. You can just look at the exact terminology. Again, a very difficult book for me to handle. So at this point, we are at the half of this book, isn't it? So it suddenly becomes easier to manage this book. See, it's not desperate to close by itself. So what is there at the end of everything? There's a summary which is very nice. So this is about gastrointestinal diseases. Inherited bleeding disorders like hemophilia A, paraneoplastic syndromes, acanthosis nigricans, paraneoplastic pemphigus, dermatomyositis, so many other things which are paraneoplastic syndromes, and they can be caused because of what? As simple as an acanthosis nigricans, which can just be because of obesity or insulin resistance, can actually indicate carcinoma of stomach, lung, or uterus. Wow. What else do you have? Do you have sensory neuropathy? Then it can be SCLC. What is SCLC? Let's see what SCLC is. Please tell me that you have mentioned here what SCLC is. See, SCLC is small cell lung cancer. Okay. But what I didn't like in this book is, let me directly tell you what I think is the problem. Here you're writing it a small cell carcinoma of lung. Then why in the other place you're writing SCLC? Because there's no place here. That's why you're writing SCLC. But here there's place, right? Then why write SCLC here, but expand it here? Because in other places also, small cell carcinoma of lung, they have expanded and written. But I'm not sure why in other places it's written SCLC. Okay. Maybe they can explain to me why. So it's a very detailed review of this book. And this is the latest edition. That's all for now. Bye-bye.